Today has been a highly anticipated and highly requested episode. I get a lot of questions about a condition that can lead to more pain. It can kind of flare up at times, and then it can quiet down, and then it can flare up again. So it makes it a little difficult to deal with, and it can be very frustrating. And this condition can be common with osteoarthritis, whether it's in your spine, whether it's in your knee, in your hip. Whenever pain impacts the way you move, this condition can come up and it can start to limit you, just from the severity of pain and just the limitations in movements that you might experience. Now, what is this condition? This condition is sciatica, and there's been a lot of misconceptions about sciaticas. A lot of times it gets misdiagnosed, but I brought on one of my fellow PT friends, and we are going to talk about sciatica, what you can do to prevent it from happening, because a lot of times you see it resurge and you start to experience symptoms even if it's been a few years, and what you can do for it. So I want to introduce you to Dr. Emily Warren, who is a physical therapist here in Utah as well. And Emily, if you just want to go ahead and give us a little bit of background and what you specialize in.
Yeah, thanks, Alyssa, and thanks for having me on. This is fun. I like to collaborate with other PTs, keep people moving. Yes, I'm a physical therapist. I've been a PT for over 10 years, and currently I own my own practice, helping people resolve back pain, avoid surgery and injections, and stay active. So I primarily specialize in the spine, and I converge a lot of different methods, primarily using the McKinsey method for getting people's pain down quickly, and then helping them understand their pain, what's driving it, and giving them some other tools in their tool belt to help manage it and prevent it in the future, so they can stay active for the long haul. So that's a little bit about myself.
And very similar to all of the things that we believe here at Keep the Adventure Alive, which is another reason why I wanted to bring you on. Now, I want to just talk first about if somebody came to you and said, I was told I have sciatica, or maybe I was looking online and I think I have sciatica. How would you describe the condition to somebody? Or if somebody's listening and perhaps doesn't quite know what it is, how would you start by describing that?
Yeah, so great question. So sciatica is typically, people use it very broadly, the term, and actually it's a bit more narrow than what we use it. So sciatica is often thrown at like just any pain down the leg, and it's actually not. Sciatica is pain down the leg that involves the sciatic nerve, which courses through the buttocks. It comes from the lumbar spine and the sacral nerve roots, and then courses through the buttocks down the back of the leg. And usually typical, like the actual technical presentation of sciatica is when the sciatic nerve is involved. So that can be pain down the leg, into the calf, or even the side or front of the lower leg, into the top of the foot, or it could be the side of the foot. So it's really sciatic nerve involvement. So it kind of gets tricky because sometimes we throw that term at it and it's actually not sciatica. So the things, if I can go ahead and go into what my brain does when someone starts saying I have sciatica, I'm thinking, okay, I ask them what their symptoms are like. And I'm usually wanting to know, is this, because it kind of can be like 4 kind of causes if it's tissue related, meaning physical, like the structure, right? Lumbar spine, it could definitely be coming from the lumbar spine. And I want to know, what do movements of the back do to people's symptoms? Does it make it worse? Does it make it better? That kind of thing. And that gives me some good hints of, oh, this is actually coming from the low back, and that is sciatica, whenever it's more of a origin of the back, the low back. Okay. Now it could also be muscle tension, like tension in the tissues. So like the piriformis syndrome, right? We all know piriformis syndrome. And that can also be a cause of symptoms down the leg as well. Tension in that piriformis muscle, which the sciatic nerve kind of dives down underneath the piriformis.
And explain
muscle.
just where that is, just for somebody who might not know what that is.
It's in your butt. So the piriformis, it is in your butt. It attaches from the pelvis. So it would say like the sacrum, the base of the sacrum, on the back side. I'm gonna just bend, so back side, like right here, and then it courses over towards the hip. So that is, or the top of the femur bone, so like your hip joint. So that's where the piriformis muscle is, and if there's tension there, that can create symptoms down the leg. Also, a couple other things. There could be some pelvic floor tension. So if there's symptoms down the leg, I want to know, is this lumbar spine? Is this more piriformis irritation, right? Could it be pelvic floor? Okay, so there's some deep muscles that are pretty close to the piriformis that can be super tense and tight and can cause symptoms in the hamstring too, in the hip, deep in the hip. So there's a lot of things to tease out. Don't want to make it super complicated, but this is where my brain goes. And then lastly, the hip joint. I want to clear the hip joint as well, because that can refer pain too. But typical hip pain is more in the front, like the groin, front of the thigh. So, but I'm just kind of teasing those things out. So when someone says I have sciatica, I really ask, what kind of symptoms do you have? Where is it? Where are the symptoms? When does it come on? Right? And is the spine, because that's more sciatica, true sciatica, or is it the other things like some tension that we can actually deal with? And all of these things, all of those situations, movement helps. It just has to be targeted movement, right? So it's like, ooh, what kind of movement do you need? That's what we're trying to get at here. So that is a long answer to your short question.
I like it. I think it's important to also note from that it's a little bit more complicated than just doing, like, if you were to search online sciatica, maybe relief or sciatica exercises, a lot of times you're given a stretch of the piriformis, or a lot of times you're just given some generic things. But it can be much more complicated than that. And especially if you are dealing with, say, recurring sciatica, like maybe it goes away for a little while, or recurring, I guess, symptoms that are proposed to be sciatica. You're dealing with these things and then it goes away for a little while, but then it comes back. It's important to get an understanding and to really get your movement levels assessed. Because like you were just mentioning, the way your hip moves. So if you have hip arthritis and the way your hip moves has changed, maybe it's gotten tight. If you have knee arthritis and maybe you're limping now, or your movement has changed, or you have back pain, back tightness, and your movement has changed, your posture has changed. There are so many different factors that can go into this pain down the leg, aside from just it's your sciatic nerve and you just need to stretch that piriformis muscle that we were talking about. So especially if you've noticed this resurgence or have been really limited by this sciatica pain, it's so important to get at least an assessment of how you're moving, because there's not just one thing that's going to help relieve this pain. Although there are a few things that can be very helpful for a lot of people, which we are going to discuss next. It is important to really kind of personalize that treatment. So
Absolutely.
Going along those lines, what are maybe some of the movements that you start with? And I know it's going to depend on the symptoms a little bit, but if you just want to, a lot of the common symptoms that you see, what are maybe some of the movements that can be helpful?
Yes. So let's say, okay, so for the back, and I just want to offer some really helpful things for people. So I will offer like a free download people can have on exercises for sciatica. So movements that help. So all movement in general is good. It's when there's so much pain involved, we tend to compensate, right? And then we create these patterns that are not helpful. And then, so for instance, like if someone's having a lot of pain down the leg, we're offloading a bit, we get a bit shifted over, and then there's even more pelvic floor tension because we're trying to compensate, and then that can make symptoms worse. So all that said, to your point of really get assessed, so that way you can get on it on the front end and not keep tripping you up. So movements that I love, where could we go here? It kind of depends on people's presentation, I'll say, and how they how they respond to movements, because everyone's a little different. So disclaimer, everyone's a little different. This might not be helpful for a lot of people, but in general, for sciatic pain, typical sciatica, okay, a lot of people need more extension in their lives. And I'm talking low back extension. So let's say flexion is more bending forward, sitting in your chair, sitting in your car. You're flexing that low back. There's nothing bad with flexion. We just do it a lot, right? So extension is actually super, super helpful. I'll just say broadly for people with sciatica type symptoms. But again, this is a variable. But in general, I would say if you can do more like things that are on your feet, like walking, running even. I know if you're in a lot of pain, you're probably not going to choose running, right? But anything that's like walking, hiking, you're up on your feet instead of biking. Nothing wrong with biking. I love biking, but I'm just saying like the movements that typically help and that I give people.
Sure.
Also,
So even like in say elliptical, or
yep,
say even just like seated, arching your back and then going through like so there are a lot of ways, even just without, because sometimes a lot of times people have pain standing in a prolonged period of time, but it's that movement aspect that I think is important, of
yes,
getting yourself out of this kind of rounded posture. And a lot of times when you're in pain, you want to sit more, you want to rest more, but really it's that movement piece of changing your postures, which I think is a super
exactly.
important point.
Yeah, and I would say a couple of my other go-tos for people with sciatic pain, depends on how they respond, but I would say lay on your belly. If you're really symptomatic and you're having some pretty good pain down your leg, lay on your belly, okay? Because you are getting some type of extension through the spine, and a lot of people can't tolerate that. So I kind of build it up, and this is where the one-to-one really works with people. But laying on your belly is good if you're flared. And then building up to like doing some like kind of cobra poses where you're extending your spine a little bit. But that's over time, especially if you're really flared up. But those are my go-tos. Now that's from the spine. And so let's talk about like if it's actually more piriformis related. Okay. So those are my go-tos for the spine. But if you notice, I think the people that have a lot of people with sciatic pain tend to go for hamstring stretching, and they go for piriformis stretching, like that figure 4 where you put your ankle on your knee and you bend forward. And sometimes they may notice this actually is not helping over time. And if that's not helping for you, it might be low back. Okay. And you're actually not really doing the movements that you need to. I'm glad they're doing movements, and I'm glad they're trying. But if it's piriformis related, then let's do some deep hip stretching. Okay. And even some and you can do this seated, where you're putting your ankle on your opposite knee and leaning forward, those ones that I was describing, gentle hamstring stretching. And it can be dynamic too. So, and you do a lot of these type of exercises, and I love that about your programs, is that you are moving gently first, like just really getting the joints warmed up. I think that's great, especially if it's more tightness in the hip driving it. Doing some gentle warm-ups where you're moving the joints in all directions, nice and easy. And then you get into bigger motions and you can hold a bit. You can end with more of a static stretch. So I would always say, start with a little bit more dynamic, where you're like, and an example, let's just say an example would be you're standing at your kitchen counter, hold on to the counter, and then you're just swinging your leg forward and back, right? Side to side. You can do leg swings, right? Or steps. You can go outside, that kind of thing. And then you can do more of a static stretch after that. That's really, really good for getting that blood flow going, so to the joint.
Yes.
So
No, that's awesome.
those are my top ones.
And I want to know if you see a lot of people that say have osteoarthritis, primarily of the hip and or knee, and do you see any connection with, and if so, I probably already know the answer to this, because a lot of compensations can impact that. But when it comes to osteoarthritis, of course, people do tend to reduce their physical activity, tend to change the way they're moving because of pain, because of tightness that may be ensuing stiffness. So, are there any considerations specifically to people that maybe are dealing with a stiff knee or a stiff hip, a stiff back? You did kind of mention just some general gentle movement, but are there any other considerations for somebody listening that has osteoarthritis, has been dealing with pain for a while, then all of a sudden they start getting this pain down their leg? Or is there any like just general advice that just to be helpful and how to perhaps shift the mindset of pain
Mhm.
even?
Yeah. Really good question, because that's super common. Like, just that we have pain, we want to avoid it, right? And so we do everything we can to avoid it. And then we're also fearing, where is this going to go? Am I going to get worse? What do I need to do to not get worse, right? So that's very, very common in general. So I would start with like big picture encouragement. Like, yes, you found this thing on an image, right? You have OA. Or for me, it'd be like you found degenerative disc disease in your back, right? But the imaging may or may not be very helpful with figuring out why you're having pain and what we can do to get out of it. Okay. So, all that said, I would say let's remember that all tissues heal in the body. Okay. All tissues can change, right? We're not this solid brick walking around. We have blood moving through us. Our bodies are bent toward, or like are wanting to heal. They're going to heal. We just need to know that we can keep moving, and we can find pain-free movement patterns or pain-free movements, or at least as minimal as possible. And that's where we need to start. So I would say, remember that tissues heal. Remember that you can always learn, right? And just having a good person supporting you through that is really, really helpful. Like, you and your programs, you're helping people kind of get out of that mindset of like, oh, this is something that's going to haunt me the rest of my life. I can't do what I want to do. And so I would just say, keep moving, right? Let's find somewhere where you can start. Okay, let's find a good baseline for you. So set some baselines where you're like, you know what? I'm super stiff. I don't feel like I can go out and walk a mile, but let's find a baseline that you can start with and do it maybe every day. And let's just like start grading that up. So if that's like doing some sit to stands from a high surface first to build up the quads, and then you stand in your kitchen and you're just pacing, like you're taking steps. So I'd say, yeah, I think everyone can start somewhere, wherever they're at. And so we just need to find where that level is for you. And then we're going to work on building that up. And over time, as you build up not only your physical capacity, because it will happen, like your tissues adapt, they're going to get stronger. If you keep putting a load on them, like a good load, not like you're going out and getting underneath a barbell yet. But if you keep putting the load on them, they're going to change. They're just going to. That's what they're set to do. It's not like they're going to atrophy with doing that. And your confidence is going to get better, and you're going to learn like what pain is good, where I can push into this a little bit. And like, because there's going to be some pain, especially if you're dealing with OA and a history of like kind of avoiding the movement, right? So you're going to have to find that relationship, and you coach people really well too on like, what's a good pain and where can you play with it a little bit? And then what's like, I pushed it too far and I might not sleep well because my joints are going to be really, really exhausted tonight. So I don't know if that's a direct answer to your question, but I would say I just want to encourage people that tissues heal, tissues change. They're going to adapt. If you load it in whatever way that you can get to loading it, give me something, right? Give me some knee kicks, give me some ball squeezes, whatever, it's going to change. And so just expect it to.
Yeah. And I think that an important point on top of that is pain is indicating that you have to make a change somewhere. So say if you start experiencing sciatica pain, you have to make a change to what you're currently doing. Continuing to do what you normally do may not, or probably will not, change the pain. So you have to think a lot of the suggestions that you just mentioned. how can you change your movement? Do I need to walk more? If walking feels good, do I need to increase that just a little bit and see how that feels? Do I need to add in a couple of movements throughout the day to reduce stiffness, which then will increase my gait, which will make my gait or your walking easier, your walking pattern, or there's all kinds of different things. And you mentioned a lot of really great suggestions. And I think it's just conceptualizing, okay, if you have been dealing with osteoarthritis, then you get these new symptoms of sciatica. Okay, what do I need to do to change? Have I changed anything in the past? Like, have you started walking more and then developed this? Start just to kind of reflect and think about changing your movement in the future, but also looking back and seeing maybe what has changed that maybe has led to these symptoms. And I want to just mention that briefly and ask about a lot of people that I have talked to that have osteoarthritis may have experienced sciatica sometime in their past, but are also worried about it coming back, or maybe have experienced it actually coming back. Is there anything you can do to work to prevent it from recurring, or at least reduce the risk of it coming back?
Yeah, so everyone has or I will say a lot of people have different causes for their sciatica, but I would say this is really broad and really simple, but keep moving your joints in all ranges, especially the back. Okay. So a lot of times over time, we stop moving into these ranges we could go because it might just feel threatening. Now, this is side note, if you have osteoporosis, that's like severe osteoporosis, I wouldn't want you to do like all these ranges without like someone coaching you through it. So that's, everyone has different conditions, but to prevent it, moving your spine in all directions. Movement, I don't know. I mean, and because it's getting blood flow, it's getting the all the good stuff going. And I'll just say broadly, that's the best thing you can do. So,
Sure.
And I will provide a handout where it shows you some of my simple go-tos for the low back, what I like to give people. And but that's the best thing people can do is keep moving. But if it keeps tripping you up, then there might be something that you haven't addressed yet, like what you're saying, but keep moving, move in ways that are really, really helpful for you, that you love. And then there's some basic exercises I'll give your followers too that you can do just to move the joints in a way that they typically don't go during the day. That's actually really, really helpful for back pain and sciatica pain. And to prevent it.
And I think that it's also important to note that your back doesn't just move like in a bending and like standing up straight. Because when people have osteoarthritis, it typically becomes, okay, just go out and walk for exercise. Like that's all that is safe to do. But your back, like you can rotate your back. Like think about the last time, like, I mean, sometimes when you're like playing sports or you're maybe working out in a gym, or you're, I don't know, even sometimes being very social or something, you're very active in the community, you get that rotation. Like, I mean, somewhat of twisting or rotating side to side.
Right.
But then also like bending side to side, like different things that you don't typically think about. I mean, I just feel like we have just been programmed to move. And especially when you're dealing with pain in this forward direction, like you're moving in a one directional
yes
movement, I guess.
Yeah, just one plane of movement.
Yes,
Flexion.
one plane. Yes.
Yeah.
So you don't get a lot of that. I mean, even it goes right to the neck too. Like we don't like turn your head side to side, like maybe when you're driving, but so your body just gets used to this, and then it tightens up and can impact the way that your body's responding. So I think that it's so important that you said keep moving, and it's challenging those different planes of motion, that rotation, that bending, maybe further forward than you usually do, etc. So it's just kind of thinking about again, that variety that I harp on continuously, that variety is moving side to side, different things, but it's also moving your body in different ways. And I think one thing that will be helpful for that is being open-minded to try new things. That sometimes you get into this mindset of, well, I have pain, that's not going to work for me, or I can't do that. But it's just being open-minded to say, oh, maybe I could try that and see how it feels. And of course, we're not going to put you in a position that's going to be dangerous for you, but it just may be scary at first because you haven't done it in a while. So I think that absolutely the keep moving and adding that variety and moving your spine in different ways is so incredibly important.
Yes, totally. And I will say, can I say, add something to that?
Yeah, absolutely.
One thing I would even recommend your followers to experiment with if they haven't, and if they're having like chronic back issues or even just chronic pain, movement practices like Tai Chi and Qigong are very good for that. So if they want gentle practices, right, and they're not ready for these big movements, but they want to move the joints in all directions in like a pain-free way, it's different, it's sensory rich, like you're getting these different cues that us in the Western world don't typically do. We're like, what?
Sure.
Hold your body, like what? I actually prescribe some of my clients, depending on their pain and how they're responding. I prescribe Tai Chi and Qigong. It's called Qigong. It's just a really good range of motion practice. It's really gentle, and it gets into your nervous system too. It definitely taps into the nervous system. So if anyone wants to experiment with that, that's something I would recommend too. If you struggle with some chronic pain or OA, anyone really would benefit from it. Especially for people who are a little more timid with jumping into exercise and lifting, right? Start somewhere, try Google, I don't know, YouTube Tai Chi.
I'm sure YouTube has tons of small routines and things to try, and tons of different options. And that's awesome. I mean, the whole goal of this podcast is really just to show that there are options and provide you with some options to try. And I think that is an absolutely awesome option, because it's been shown also to help with osteoarthritis just in general. Like you had mentioned, it's not only, showing different spine movements and things, but it's also helping to really say, oh, wow, I can actually move and I don't have to always experience pain, because that's the ultimate goal that we want to get to build that confidence and movement again. So if somebody is listening right now and they're perhaps dealing with sciatica pain, or maybe have had it in the past, what are maybe some parting words that you would like to say to them?
Their movement is medicine, and you just need to find the right targeted movement first to get you out over that hump, and find a good person you can work with that can help you understand what's going on and what you need to do to get out of it. Okay. So for most people, I don't even need to put my hands on them to help them and help them find what will get their symptoms down. And so movement is best. Let's just find the tools that you need. So there's definitely hope. If you're struggling with sciatica that's lasted a long time, then there's reasons for that. And we can find that actually. And so you can get out of pain. I just say, like, tissues heal. Our body heals, right? And our brain changes. We always learn. It's always wanting to rewire and learn. So people can get out of pain, right? And it might be this thing that kind of comes back, but if we have the tools to use, like some movement tools, right? And even mindfulness tools, whatever, to help them get out of that, then that's so empowering for people. They don't have to go and do surgery, or surgery is actually helpful for some things, for sure. I'm not anti-surgery, but I'm just saying there's so many options, and most of us can get out of it, especially without surgery. So
absolutely. And of course, if you've been listening to this podcast, you know that I also agree with that. There's certainly a time and a place for surgery, but there also is hope, and research does point to, even in back pain, point to trying conservative measures first. It's always worth a try to see if your body will respond to it positively. Just like anything else, it's not always 100% accurate, and it's not always 100% effective, but movement's not necessarily going to inhibit your surgical process either, because the stronger you go into it, the stronger you go out of it. So there's nothing really to lose trying movement first.
Right.
And if somebody is interested in working with you, where are you located? And then if they're not in Utah or not near us, where can they find you?
If they want to work with me, I provide virtual or in person, so coaching or physical therapy. So within the state of Utah, and I'm licensed in Oklahoma, but they can also find me. I have a website, emilywarrendpt.com, or Instagram. I mainly post mostly to Instagram, and my tag is Dr. Emily Warren, DPT. And on my website, and I think on my Instagram as well, the bio, I have some freebies for you guys if you want to download those that help you understand more of some exercises you could do for some specific conditions. And I'll be providing that for your followers too. So that will be a freebie for you guys, some exercises for sciatica.
Perfect. And I will put all of those links down below. So if you're listening, go to the show notes and you can see the links on how to follow her, and then also how to get the free guide on the sciatica exercises. And then if you're watching on YouTube, it'll just be down in the description below. I just want to say thank you so much for joining us. And I hope that if you're listening and or watching, that you found this helpful and maybe took away some tidbits to help you manage sciatica or to prevent it from reoccurring. Thank you so much.
Thanks, Alyssa.